All right. Hi, guys. Thank you for taking the time to listen to our presentation on the cardiovascular system. My name is Molly Jennings, and this is Riley Blood. Working in the emergency department at local hospitals has given us several firsthand experiences with acute cardiac emergencies. Our interest in researching advanced cardiac assessment, pathology, and pharmacology related to the swift critical thinking and decision-making skills needed to care for the heart and related cardiac emergencies at our jobs. So this is our presentation on STEMIs. Okay. At the conclusion of this presentation, listeners will be able to conduct focused cardiac assessments and explain related pathophysiology, define STEMI and describe its implications on the cardiovascular system, list common physical assessment findings that present with STEMIs, list common signs and symptoms of STEMIs in men and women, outline diagnostic tests that present with STEMIs, discuss nursing interventions and procedural therapies involved in the treatment, learn commonly used pharmacological therapies and their purpose, explain strategies related to the health teaching, self-management, and risk reduction medication compliance. Okay, an overview of the cardiac system. The heart is comprised of 4 chambers made up of muscle and powered by electrical impulse. Blood flows through the heart is systematic. Blood passes through the right atria and into the ventricle and is reoxygenated via the pulmonary system and returned through the left atria and ventricle for redistribution to the body. The flow of blood is made possible through the electrical impulses firing and contracting the heart muscle. There's a total of 4 valves that help move the blood through this system and chambers. The upper image illustrates the right and left coronary arteries, circumflex artery, and the left anterior descending artery. These are responsible for supplying blood to the heart muscle. Without blood supply to the cardiac muscle, the heart would be unable to perform its function. Interruption in this blood flow to the cardiac tissue leads to cardiac emergencies, often known as a myocardial infarction, an MI, or a STEMI or NSTEMI.
Okay, I'm just going to move us out of the way here. The blood flows through the heart in a very specific and distinct pattern, and when that doesn't happen, there's something that throughout the body may be affected by it. So blood flows through the heart. I'm going to hopefully see the mouse through here. The superior vena cava and the inferior vena cava are the veins that return the blood from the rest of the body. They go into the right atrium here, and then through the tricuspid valve here into the ventricle. After the ventricle contracts, it shoots up the blood through the pulmonary valve into the pulmonary artery, which ends up going to the lungs, so the blood can become oxygenated. After the blood becomes oxygenated in the lungs, it returns through the pulmonary veins and into the left atrium, which contracts and goes through the mitral valve here, down into the left ventricle here. The left ventricle then contracts and shoots the blood to the aortic, through the aortic valve and through the aorta to the rest of the body. The blue here represents when the blood is not currently oxygenated and has not reached the lungs yet. And then the red here represents when the blood is oxygenated and is going to the rest of the body and provides that oxygenation to all of the body cells and the vital organs. Sorry, I'm trying to get to the next screen here. Okay, I'll move us back up out of the way. Okay, the heart has a few functions of the cardiac system. It first provides oxygen-rich blood to the vital organs, which I just spoke about. Once it comes back from the lungs, then it can pump the blood to the rest of the body that is carrying, the blood is carrying the oxygen. It removes waste such as carbon dioxide, and it carries it, the blood is carried to the excretory organs such as the kidneys for excretion. Then it also provides cells with nutrients. The blood gathers nutrients from the small intestine and carries it to all organs. It also transports hormones to target cells and organs. It collects these hormones through the blood and delivers it to the appropriate cells. And then lastly, it regulates body temperature, constricts and dilating veins for body temperature regulation is how this occurs throughout the body.
Okay, so now we'll move into the ST elevation myocardial infarction, or STEMI. A STEMI is a life-threatening type of heart attack that requires immediate medical attention. This type of heart attack receives its name based on how it affects the lower chambers of the heart and the electrical impulse that passes through it. This is illustrated on an EKG in the picture above, where the ST segment shows an abnormal elevation.
Okay, as Molly just said, the STEMI, a myocardial infarction, gets its name after its unique appearance on the EKG. As you can see down in the lower right-hand corner of this picture, the S part is the end of the ventricle depolarization, and the T wave is the repolarization of the ventricles. This is a time where there should be no electrical impulse, and it should be isoelectric at the bottom here and return to baseline. If it's not, it shows up on that EKG, and it is very distinct for a STEMI. As I said, it's a myocardial infarction, which is the worst kind of acute coronary syndrome that can occur. It affects the lower chambers of the heart, which are an infarction in the ventricles, meaning that the ventricles are not getting adequate blood perfusion. And when poor adequate blood perfusion is not occurring, then the cardiac muscle cannot pump accurately. So the way that this happens, the way that the arteries become blocked is from a plaque or a clot. In that picture there, you can see that there's plaque buildup in the artery, and the blood cannot flow properly through there. So that blood is slowed down, creating that blood clot there. 3 of the arteries in the heart that create a STEMI on the EKG are the left anterior descending artery, the right coronary artery, and the left circumflex artery. The left anterior descending artery is considered an anterior STEMI, and it is the worst kind of STEMI that's occurring because the artery is going to the left ventricle, which, as I stated earlier, the left ventricle pumps the blood to the rest of the body. So if the blood cannot be pumped to the rest of the body and other vital organs, that is very bad. This is called cardiogenic shock. The heart is not adequately pumping blood to the vital organs. Oops. Okay, here is a clearer picture of the coronary arteries on the heart. As we talked about earlier, the left anterior descending artery is here, this one here, and it goes all the way down into this left ventricle. It supplies blood to the front and to the bottom of the left ventricle, and this is why if it's not properly perfusing the left ventricle, it causes the cardiogenic shock. Dying ventricles cannot adequately perfuse the rest of the body because they're not getting enough of the blood right in through here. The right coronary artery, it's considered an inferior STEMI, and that is right through here, as you can see on the picture. And then the left circumflex artery is here, supplies blood to the left atrium and to the side and back of the left ventricle. Sorry, this is having a hard time going.
Okay, so Riley just talked about what STEMIs are and what they look like. Now we will talk a little bit more about the pathophysiology behind it. So heart attacks can happen very quickly and time is of importance. Annually, the US has roughly 550,000 new heart attacks and 200,000 repeat heart attacks. So who, what, why, and how? Anyone can have a heart attack, and the risk increases for men above 45 and women above 50. Additionally, those with a family history of cardiac issues and genetic conditions are at a higher risk. Diagnoses like hyperlipidemia, kidney disease, diabetes, and obesity, or high levels of stress can also increase the risk of having an MI. What is an MI? An MI is an interruption in the blood flow due to a blockage, such as plaque, that can cause death to the cardiac muscle. Blockages can be of plaque or from blood clots. A STEMI is a type of MI that presents in a distinct pattern on an EKG with an ST elevation, as Riley discussed in the past slide. And this can clue to a blockage in one of the main arteries that supplies blood to the heart. MIs can result from a number of things: family histories, diagnoses, comorbidities, poor diet, and lacks of exercise are a few of those reasons. And the how. Buildup of plaque within arteries and the presence of a clot, in this case, within the artery supplying the heart tissue itself, can lead to symptom onset and clue patients into having an MI.
Okay, some symptoms that somebody can present who is having a STEMI include chest pain, shortness of breath, dizziness, diaphoresis, pallor, palpitations, the changes in the ST segment of 1 millimeter or more, tachyarrhythmias, and decreased level of consciousness. It can be a variety of any of these, 1, 2, or 3 of them. It's not presenting as a specific way at all. It's very individualized for each person. Although women do sometimes present with different symptoms than men do, and some of these include insomnia, fatigue, and referred pain to the back, shoulders, jaw, neck, arms, and or the abdomen. So it's very important when assessing the patient that you get the whole entire history and symptoms of when they started, and most importantly, the EKG, because that is the most prominent diagnosis test that will be completed for the STEMI.
Okay, so now that we've looked at what a STEMI is, the patho behind it, and the symptoms of it, we move on to the nursing assessment portion of it. It's important that a detailed history is gathered when a patient presents with chest pain, information about the time that it started, the symptoms they were having, what they were doing, what brought the pain on, what it feels like, whether it moves to the neck, jaw, or shoulder is important to know, as well as how severe it is and whether or not they have a family history. It's important we know about the family history because it can clue the healthcare providers into what they may be having, and it kind of is important in like determining their increased risk for having something. Getting to know their other comorbidities and the daily meds they take is also important. If they're on blood thinners already, or if not, that kind of decreases their risk of a blood clot if they are on one. Other systems that we want to take into account when assessing a patient with chest pain, the heart, of course, we want to listen to it. We want to note the rate of it, see how fast it's going, and then obviously assess the pain. We also want to look at the lungs and how they're functioning, the sound of it, how fast they're breathing. Is it shallow or deep? Are they having to work for it? We want to look at their level of consciousness and mentation. Are they kind of drowsy? And also, importantly, we want to look at their skin. We want to know the temperature of it, the color of it. Are they clammy, diaphoretic? All of those things kind of clue us into the symptoms of a STEMI and are important to know for the treatment.
Okay, so we'll talk about now the risk factors of a STEMI. There are two different categories that you can put the risk factors in. One is modifiable, the other is non-modifiable. The modifiable ones are obviously the ones that you can change. Starting with your stress levels. Increased stress levels can affect how the body responds to things and can actually put you at an increased risk of a heart attack. Um, Alcohol, tobacco, or drug use. Obviously, we choose how much or if we participate in any of those at all. Um, so, increased alcohol usage and constant tobacco use increases that risk, but also drug use, and specifically with amphetamines and cocaine. These are stimulant drugs and they will increase your risk much more than other drugs. Your diet. An increased fat and sodium diet are two of the ways that it can increase your risk of having plaques or hypertension. The fat is what builds up in your arteries as plaques, and then hypertension is directly related to the cardiovascular system. A sedentary lifestyle, this also increases your risk of developing those plaques because the exercise actually clears the plaques and prevents buildup in the artery. Comorbidities, as Molly stated, will impact your risks. For example, diabetes and hypertension. And then lastly, obesity, which is directly related to your sedentary lifestyle, gaining weight and not being able to clear your arteries of the plaques very well, and poor eating will contribute to this. A few non-modifiable risk factors include your age. An increase in age will increase your risk as well. Men start at 45 years old and above, they have a greater risk, and then women 50 years and above have an increased risk. The sex that you were obviously born with, that affects it as well. Uh, Biological men, they are at an increased risk rather than biological women. And then hereditary, if your family members, like your mom, dad, brother, sister, grandpa, grandma, if any of them had a heart attack or any cardiac issues in their history, this may also increase your risk of having any coronary issues or a heart attack. Lastly, your ethnic background. Blacks, Hispanic, and American Indians are at a higher risk of having heart attacks based off of their lifestyle and determinants of health that actually impact their modifiable risk factors and increase their overall risk of having a heart attack. Okay, now we're going to talk about the diagnostic tests that are completed for a STEMI. First and foremost is that EKG. As we've stated a few times here, that ST elevation is what differentiates this heart attack from others. So seeing that ST elevation means that it is in one of those three different coronary arteries, and it needs to be treated rapidly because the chambers of the heart are not getting adequately perfused. Lab work is going to be completed. The most important one in an acute situation for a STEMI is the troponin. The troponin shows that there is already damage and ischemia to the cardiac tissues. The other two listed here, myoglobin and the creatinine kinase, are two that essentially are for like post cardiac treatment, and they just show how much the heart was damaged and unable to be revived essentially after treatment of the STEMI. And then presence of symptoms, all the symptoms that we've listed earlier, those go hand in hand essentially with the troponin and the EKG. Those symptoms that they're presenting with actually determine whether or not we're going to get an EKG on the person. So that's really important to realize that women do present with different symptoms than men because this may delay their treatment or diagnostic tests. And time is tissue with this situation because if they're not getting adequate perfusion, then more cardiac muscle will die as time continues. And then lastly, a CT scan, this is less common in an acute situation, especially if the EKG is done within a timely manner. But this does show the in-depth images of the heart and blood flow of the heart with contrast. This may be done if the person presents in those symptoms that may not directly point to a heart attack, and this may be completed, and they could see that through the CT scan as well.
All right, and now I just want to talk a little bit more about an EKG as it is the primary diagnostic tool for a STEMI and is really a true indicator of whether you're having one given the time sensitivity involved with STEMIs. So each section of an EKG, which you can see kind of with the different shades of colors in that top image, shows a different area of the heart, if you want to say, with the cardiac leads. So depending on where the ST elevation is, can clue providers into which coronary artery has a blockage and kind of guide them to where they need to go as an intervention to kind of relieve the plaque formation. Okay. The American Journal of Cardiology published some clinical practice guidelines regarding the medication treatments when managing a STEMI. Medications that are recommended to use are aspirin for antiplatelet agents to reduce clotting, a heparin bolus for anticoagulation to reduce and prevent clotting, especially prior to treatment going in there. Brilinta as another antiplatelet to decrease thrombi, and the use of nitrates, or like the nitro pills that people have, to vasodilate and kind of relieve the chest pain. Patients don't always have access to nitroglycerin beforehand, but they would likely be sent home with this following a STEMI for future use if chest pain does recur, and it has certain parameters to use for that before seeking help again. So other medications such as beta blockers can be used to control the blood pressure by decreasing the afterload and the heart rate. Also kind of a preventative med for patients who have had cardiac events. Morphine may be used to control chest pain in an acute setting. And then another kind of more long-term medication would be the introducing statins into the medication regimen to help reduce the cholesterol and decrease the risk of plaque formation. And then while they're having chest pain, we want to make sure that their saturations are above 90%. If the heart already has decreased blood perfusion to it, we don't want to make matters worse with lowering the levels of oxygen in the blood that the tissue may be getting. So keeping those above 90 is crucial. It is important to note that with these meds, some contraindications with their personal history and medication list is important. If they're on like heavy blood thinners like warfarin, it's not advised to like completely pump them full of heparin for their entire stay. So you'd need to watch their anticoagulation status closely.
Okay, now we'll talk about procedural therapy that is done for a STEMI. The first one is a percutaneous transluminal coronary angioplasty. It's a lot of words for a procedure that is where they insert a catheter into an artery, usually the femoral because it's the biggest and and very close to the heart. It could also be an artery in the wrist or the arm. X-rays are taken to visualize the coronary artery, and this is in real time X-rays that are done. A balloon-tipped catheter is an advance into the heart and into the narrow artery that is causing the STEMI, and you can kind of see in the picture there that plaque buildup. The balloon is inflated and deflated several times to compress the plaque and widen the artery. And then blood flow should improve when they decrease the plaque and widen the artery. A stent is also usually placed. You can see there. It just helps keep the artery open. And then this is also completed in the cardiac catheterization lab. Usually takes up about 1 to 2 hours to complete. And this is the less invasive procedural therapy that is performed. And then another procedural therapy that is done is called a bypass graft, also known as a cabbage. So what is done, they create a new passageway for the blood to perfuse the heart, essentially going around the blockage. As you can see here in this picture, these two small bypasses that they create are what go around the blockage. So they do this by getting blood vessels from the body that is used for that bypass. It's called the graft. They can use it from the saphenous vein in the leg, the internal mammary artery in the chest, or the radial artery in the arm. On one end of the graft, it's placed above the blockage, and then the other is placed below the blockage. So that way the blood flow can go all the way around the blockage and still perfuse the heart. This is more invasive and it can be considered open heart surgery. Some self-management therapies that people can do to reduce their risk of having a STEMI or also reduce their risk of having subsequent heart attacks, cardiac issues, or STEMIs in the future. Daily exercise to maintain a healthy heart and reduce weight. So we talked about this earlier. It's important to exercise to keep the heart healthy and to decrease the cholesterol and plaque buildup in the arteries. A heart healthy diet, which we will talk about in the next few slides here. Watch for signs of infection in the surgical sites that were completed in their previous STEMI procedural therapies. Decrease emotional stress, smoking cessation, and then manage health conditions such as hypertension, hyperlipidemia, high cholesterol, and diabetes, which all are related to the increased risk of a STEMI. Take all medications as recommended. If they don't, then all of the symptoms can start to occur and all of the unmanaged health conditions can get worse. And then understand the signs and symptoms of the heart emergencies so that way we can get them treated rapidly. All right, a heart healthy diet here, it includes low sodium, which is less than 2 grams per day, low cholesterol, less than 200 milligrams per day, to avoid trans fats, and only 25 to 35% of daily calories should come from fats, and then limit alcohol beverages to 1 to 2 per day.
Further education to patients regarding a heart healthy diet choice is an important piece of healthcare management. Eating lean meats, whole grains, and having low fat intake, eating lots of fruits and vegetables, and using unsaturated fats and oils to cook with are all appropriate recommendations to follow a heart healthy diet. Patients should also be educated on foods to avoid, including like fried foods, foods that are high in fats, meats that are high in fat, cold cut meats, as they are highly processed and contain a lot of sodium, as well as to limit their intake of alcohol and tobacco, as they place more stress on the heart and increase their risk for plaque formation. All right, so now we've reached the end of the presentation. In summary, we wanted to highlight that the cardiovascular system is highly important to survival as it connects all of the it connects with all of the organs in the body, pumping blood and nutrients to it. So impairment of the cardiac system affects the entire body. STEMIs are important medical emergencies as they're highly time sensitive and often require heart surgery. So it's important that we as healthcare providers grab an EKG and blood work as quickly as possible to identify these blockages and get them taken care of to decrease the risk of cardiac impairment, because time is tissue. It's also important that we are able to rapidly identify symptoms of STEMIs with chest pain, as they vary greatly between individuals, especially between men and women. We really want to know about the pain, where it's at, if it moves, what it feels like when it started, and then also assess other body organs like the skin, their work of breathing, and their mentation, as those are linked to the heart function as well. It's important that we also guide patients and provide them education about ways to reduce their risk by exercising, reducing stress, and following a heart healthy diet, low in sodium and cholesterol, and also giving them education about medications that may be prescribed to reduce their risk of getting an MI, such as the nitro that we talked about earlier, and putting them on statins or a blood thinner post-STEMI. We also want to talk about their modifiable risk factors, the ones I mentioned above, and then also let them know that there are things out of their control that still put them at risk, such as their age, their gender, and their ethnicity. So all those are important for patients to understand so that they work to follow healthy lifestyle choices, follow up with healthcare recommendations, see their cardiologist regularly to decrease their risk of further cardiac disease and prevent a future illness. So thank you for listening to our presentation. We hope it has taught you a little bit more about the cardiac system and more specifically STEMIs. Please feel free to reach out to us by our Mount Mercy emails if you have any questions.
Thanks, guys.